Hello dear friends, how are you today? I hope you are well. Here we are going to explain another question about dermatology. A 64-year-old woman presents with severe mucosal ulceration associated with the development of blistering lesions over her torso and arms. On examination, the blisters are flaccid and easily ruptured when touched. What is the most likely diagnosis? A. Pemphigus vulgaris. B. Pemphigoid. C. Dermatitis herpetiformis. D. Psoriasis. E. Epidermolysis bullosa. Okay, here we have a 64-year-old woman which is coming with severe mucosal ulceration. Mucosal ulceration or mucosal involvement is important with the development of blistering lesions our torso and arms, which the blisters are flaccid and easily ruptured when touched. And the most likely diagnosis here would be Pemphigus vulgaris, because the Pemphigus vulgaris, in Pemphigus vulgaris, the patients are usually in 50 to 70% of cases, the patients usually have mucosal involvement or mucosal ulceration, and their bullae are so flaccid which easily ruptured when touched. Okay, here we are going to explain it. The answer is Pemphigus vulgaris. Blisters or bullae. We have two types of blisters or bullae. If the patient is coming with blister or bullae, we have two types. If the patient has mucosal involvement, then it will be bullous pemphigoid. If the patient has no mucosal involvement, then it would be bullous pemphigoid. But if the patient has mucosal involvement, then it would be Pemphigus vulgaris. Okay, here we are going to explain about Pemphigus vulgaris. Pemphigus vulgaris is an autoimmune disease caused by antibodies direct against desmoglein 3. This is important, autoimmune disease against antibodies against desmoglein 3, which is a cadherin type epithelial cell adhesion molecule. And it's important autoimmune disease. Pemphigus vulgaris is autoimmune disease, and we must consider it in the management and treatment of the patient. Okay, here we can see different ulcerations and bullas in different patients with involvement of here we can see small blisters or bulla. We can say these are blisters in a pregnant woman with the diagnosis of Pemphigus vulgaris. Here we can see ulceration of the patient because we cannot see any clear bulla because the bulla are so flaccid and they easily rupture after touching. Here we can see also different ulcers in the body of this patient with the diagnosis of Pemphigus vulgaris. Sometimes the ulcerations of the bullas become infected, and we can see pus also, as we can see here. Here we can see the mucosal involvement or the mouth involvement in the patient with the diagnosis of Pemphigus vulgaris. We have involvement of the mucous in 50 to 70% of patients with their diagnosis of Pemphigus vulgaris. Okay, mucosal ulceration is common and often the presenting symptom. Usually the patients present or come with involvement of their mucus. Oral involvement is seen in 50 to 70% of patients. Okay, skin blistering, flaccid, easily ruptured vesicle and bulla. As we said, the bulla and vesicles are very flaccid and they easily ruptured after touching. Lesions are typically painful but not itchy. This is also important. The patient is coming with painful lesions, but they are not itchy lesions. They are usually painful. Lesions are typically painful but not itchy. This may develop months after the initial mucosal symptoms, and it's important. The first presentation of the The first presentation of the Pemphigus vulgaris can be mucosal involvement, and the blisters and bullae can develop after months of their mucosal symptoms. Okay, Nikolsky described the spread of bullae following application of horizontal tangential pressure to the skin. Nikolsky is usually positive in patients with diagnosis of Pemphigus vulgaris. Okay, acantholysis on biopsy. We can see acantholysis on the biopsy of the skin of the patient with the diagnosis of Pemphigus vulgaris because of their involvement of the superficial skin. Okay, management is usually with steroids and immunosuppressants. As we said, Pemphigus vulgaris is an autoimmune disease. That's why the management is with steroids and immunosuppressants drug. Here was a short explanation about the patients coming with mucosal involvement with mouth ulceration and flaccid bullae on the body with the diagnosis of Pemphigus vulgaris. Thank you for your attention.